Hello, this is Dr. Ford Brewer with state-of-the-art preventive medicine, available to all, at least all with access to YouTube. Today we're going to talk about insulin resistance or prediabetes and the oral medications for diabetes and prediabetes. The two most popular are Metformin and Pioglitazone. Most consider Pioglitazone running a very poor second. They consider Pioglitazone being a very difficult drug to take. We'll go over some of that in the video. First of all, though, let's understand quickly what a Cochrane study is. Cochrane, C-O-C-H-R-A-N-E. Look that up on Wikipedia. In fact, you'll find that the Cochrane organization does have a partnership with Wikipedia. There are over 300,000 Cochrane participants. What they do is look at a meta-analysis. A meta-analysis is an attempt to put different studies on a similar topic together. So it's almost like a review of the literature on an existing item. So let's talk about the Cochrane studies in this area. In 2010, there was a Cochrane study that showed something very important about metformin risk. Metformin was first discovered in the 1920s. It was available in the UK in the 1960s. It was not made available in the US until the 1990s, in fact 1995. Part of the reason for that was a fear associated with lactic acidosis. Well, in 2010, the Cochrane reviews indicated that when you actually study metformin, there was no danger of lactic acidosis. It was associated with that class of drugs. That class is called biguanides, and other members of the biguanide drug class did have lactic acidosis, but not metformin. Metformin has become the frontline recommendation from organizations like the American College of Endocrinology. The WHO, World Health Organization, did a lit review looking at metformin and found it to be superior in terms of cardiovascular outcomes, impact on cholesterol and triglycerides, and safety and side effects. So what have we seen on the side of pioglitazone and the other thiazine diones? Pioglitazone tends to have better results in terms of decreased cardiovascular events and mortality. This is probably due to a positive impact on cardiovascular inflammation. That is the finding of a recent Cochrane study. So why would there be so little use of pioglitazone and so much use of metformin if the studies actually show improved outcomes? Well, here's why. There's also increased side effects, specifically edema. That edema can even lead to heart failure in certain patients. So again, it's like the situation with ACE inhibitors versus ARBs. ACE inhibitors do have improved outcomes. It's probably due to decreased cardiovascular inflammation, but they also have some negative impact and safety issues compared to ARBs. Same thing here. Pio does have improved outcomes and decreased cardiovascular events. However, there is increased safety concerns due to edema. It's like Rosanna Dana said, for those of us who remember her, it's still always something. Thank you again.